from 1370 WSPD and a member of the Toledo Buffalo Soldiers. I mention that because part of our group is helping with the V Project, which is why we're here tonight. This is broadcast live on the V Project Facebook page, the City of Toledo's Facebook page, and also the Lucas County Health Department Facebook page. Our guest tonight to talk about the COVID-19 vaccine and the efficacy of it, the three different vaccines, and well, hopefully why you should get it and why you shouldn't be afraid to get it, are two doctors from the local area. Dr. Anthony Armstrong. Dr. Armstrong is a board certified OBGYN in a private practice group. He's got a master's in public health from the University of Michigan. Go Blue. His past experiences include president of the Toledo and Lucas County Academy of Medicine, board member of the Toledo Community Foundation, 10 years as chairman of OBGYN, 10 years as director of medical education, and 3 years as chief of staff at Mercy St. Vincent Medical Center. Our other guest is Dr. Karl Fernandez. Dr. Fernandez grew up in East Toledo in Oregon, Ohio. He is a graduate of St. Francis de Sales, the best boys high school in the city, as you are well aware if you listen to my show.
Good night.
Also went to the University of Toledo and the medical school at the Ohio State University. Did his residency and fellowship at the University of Pittsburgh in internal medicine, pulmonary, and critical care. Came back here to Toledo in 2000 and is presently with the Toledo Clinic. He's been taking direct care of COVID patients in the ICU, the medical floors, and in his office for the last year. Doctors, thank you very much for being here this evening. We really appreciate it.
Thank you for having us.
We hope to be able to answer some questions tonight. I have some that I received from listeners, and those who are watching on Facebook right now are welcome to put their questions in the chat window, and someone from the city will get those to us and we'll try to answer those. Dr. Fernandez, I want to start with you. Since you've actually been working in the ICU with patients right now for the last year, are we in a better position now, since it is March, than we were when this started last March, 2020?
The answer to that question is definitely yes. We learned a lot about the disease and how we treat the disease. What we've done in March is not the same what we're doing now. Our survival rates have gone up, and it's not a hopeless case to be admitted to the ICU. You'd rather not, of course, but there is a good chance that you will survive, unlike back in March. You know, we didn't know much about the disease. We didn't have the tools that we have now. And so, you know, the virus is a science. It's a science. There's a hypothesis. We have tested some haven't proven correct. And so we move on. What we're seeing now is that people are waiting to come into the hospital later. So when they do come in, if they have to come into the ICU, they're sicker. But also we have better tools. And I think one of them that we've used a lot is steroids. And also we've used things like non-invasive ventilation as opposed to ventilators, high flow oxygen. And so we have come a long way. It's not where we want to be.
No. One of the things that in the last year, one of the questions comes up, and either of you can answer this, is that we can't trust the science because you guys keep changing your mind. And you kind of explained just now a little bit of why that happens. Back in March of 2020, we didn't know as much about what COVID-19 was like. We didn't know what the effects would be, and we certainly didn't have a vaccine yet. So we asked people to do some things, and now we're asking them to do different things. Is there a way to calm their nerves, to convince them that, yes, we do know what we're doing. We're not just changing our minds willy-nilly over the last 12 months?
Go ahead.
Go ahead, Doctor. And then you can just follow up. So the first thing that I would say is that science sometimes is not exact, and it's ever evolving. And as Dr. Fernandez alluded to, where we were in March of last year and where we are now, we've had a wealth of experience with millions of people who have been infected, geographically separated around the globe, with all kinds of different demographics in terms of age, comorbidities, sex, ethnicity, race, and so on and so forth. So we've gathered a whole lot of data points to be able to see how this virus, even though we've known about coronaviruses for 20 to 30 years, these are some different strains. And as you're hearing, we still have some new variants that are out there, but we have a much better understanding of how this virus replicates, how it just doesn't affect the respiratory system, even though it's primarily transmitted through droplets through the respiratory tract. So we're learning continuously. And again, you're hearing about long haulers and some of the things that we didn't recognize that were probably related to SARS-CoV-2 that we are just starting to see and starting to put some science behind how to diagnose those changes, like you might see on an MRI or a CT scan of brain of people who have survived COVID-19.
Yeah.
When this
Is it
virus
just-
hit our
Go ahead.
shores, remember it came from China initially, and so the population of African Americans and Hispanics was very low, very different. So we didn't realize the disparity of and the mortality that we were going to see. The other things is, when it hit Italy, they ran out of ventilators, so they improvised, and we took some of what they did, and we are using it now, and we found, hey, that works. So science changes. It's nothing's 100% except death and taxes, and people have to realize that. And we take what we work and we try to use it and modify it. And sometimes these modifications are better, and sometimes they're not. And people just have to be patient. I mean, we really didn't know much about this disease at all in the beginning, and we are learning more and more as we go on.
Well, and with social media, we have a lot of experts now. And Dr. Armstrong touched on something, that coronavirus has actually been around. You've known about it for 20 years. This is just a particular strain of it. And people have focused on that and said, well, why didn't they do something before? If they've known about it for 20 years, they probably planned this out. And none of that has anything to do with science, does it?
No, it doesn't. It's, again, coronavirus is a virus like the common cold, and there are hundreds of different types, and that's why the testing initially also was difficult to narrow down to the COVID-19 strain. And then we developed better tests and quicker tests, and that's just an example. But a lot of the tests overlap, so we didn't know which type of strain we were using, and now we're finding out in the fall that there are UK variants, Brazilian variants, South African variants, some from America. So again, it's always changing, and that's why it's critical that we get ahead of the curve and start vaccinating people.
And you also have to
Go
remember
ahead.
that our CDC and the World Health Organization and a lot of other organizations, even nationally and internationally, they do monitoring of diseases and disease process, viruses and bacteria, et cetera. And so if people were wondering, why didn't we have a treatment or a cure for this before? This is when you're doing these monitoring, especially something like this, it was a pandemic that was very rapid onset. There was no need to have a vaccine before. So I don't want to say that we got caught with our pants down. However, once we found out about how transmissible this was, how significant the illness and morbidity and mortality with this virus, that's how we were able to develop a vaccine in what seems like a relatively short period of time.
And I'm glad you said that, because that's one of the questions that comes up a lot, is because it was developed so quickly, people don't trust it. All the protocols, though, and Dr. Fernandez, we'll start with you. All the protocols, as far as we know, were followed just like they would be for any vaccine, correct?
Absolutely correct. So the difference is that because of the urgency, the government put up the funding. The government said it was going to buy the vaccine. So the pharmaceutical companies didn't have to worry about the monetary risk, and they just went and recruited people very quickly. Were enough, for example, pregnant women, children, immunocompromised people recruited initially? No, probably not, but we're looking into that now. The protocols, especially the safety protocols, were absolutely followed to the T. And they have to be, because if the virus is going to cause problems, then it's going to be a disaster, both from a public health perspective and a trust perspective. And I'm happy to say they just looked at the Pfizer reporting compared to what they did in the trials. And the initial data seems the efficacy is the same as what they did in the trials as what we're actually seeing on the ground. So that's a good sign that what they did was working and it is safe.
Let's talk about the efficacy a little bit, Dr. Armstrong. We know, for instance, that the city just got some more Johnson & Johnson, about 300 doses. It's being used now throughout the country. I got my shot last Friday. I got a Moderna, so I'll be going back in for the second one. The Johnson & Johnson one, the J&J one, is just a one-shot treatment. What's the difference between them when it comes to what Dr. Fernandez mentioned, the efficacy of them?
There really isn't any difference, but you really can't compare them head to head. And just briefly to touch on why, it's because they were done at different points in time, and they're done on different geographic populations of people. The Johnson & Johnson vaccine was tested in the United States, Mexico, some countries in South America and South Africa. And so in between when Moderna and Pfizer were developing their vaccines on a different population of people with different variants of the virus as well. So you can't compare the two, but the Johnson product, you get full protection against hospitalization and death, and about 85% for severe illness, whereas the Moderna and Pfizer product is 94, 95% respectively. So those percentages difference is not what we would say is anything that's substantial. And so the best advice is whatever vaccine that you are available to be able to get, that's the one that you have put in your arm.
And I believe Dr. Fauci said as much just the other day. He said, if he hadn't already received one and he walked into a place to get a shot, he would take whatever they had. Now, I'm a little older. I'm 69 this year. So I got my Moderna. Is there a difference, Dr. Fernandez, in the age group and how the vaccine would react to them, whether it's Moderna, Pfizer, or J&J?
So you mean in terms of the efficacy or side effects?
Yeah, efficacy and side effects too.
So again, the age group, and I don't know the exact differences between the actual age group from the Moderna and the Pfizer, but they had a little bit of a younger age group than the Johnson & Johnson. But the efficacy, again, I think what Dr. Armstrong is saying is that our goal is to prevent people coming from the ICU, because even though we're doing things better, they die in the ICU still. So if one shot can do that, that's great, and that's what we want people to understand. You're not getting an inferior product. It might actually be better because it takes into account some of the strains like in South Africa, like in South America. And it is proven that despite that, people, once they get the shot, aren't dying in the ICU from COVID.
All right, that's the good news. Now, after I've had the vaccine, after anybody has had the vaccine, whether it's the one-shot deal or if it's the two-shot deal, what are the rules, if there are any, for visiting people, let's say outside the bubble? I've pretty much stayed in the house and go to work. We have very few people in the building right now still at the radio station. So I don't see a whole lot of people on the outside. Can that change now that I've had the one treatment?
Well, I think you still have to do things smartly. Social distance, wear a mask, and those two things are the most critical. The vaccine, we still don't know enough data whether if you have the vaccine, if you can still get COVID and transmit COVID. There is a window where you don't have the antibodies. So that's why we're saying that you still have to do that. Our hope is that the number of people and the number of cases, hospitalizations will go down as people get vaccinated because they won't be as sick. But you still have to take some necessary precautions before you do that. I had patients come in, can I visit my, grandmother, or can I go fly out to, a certain place to visit the grandchildren? And again, take the necessary precautions, and you can. Nothing, like I said, nothing's 100%, but it's just going to help.
So, Dr. Armstrong, I'm still wearing a mask when I go out in public, and I am social distancing, so I'm okay there. But what about treatment afterwards? Now, I didn't really have anything bad happen to me. My arm was a little bit sore, little bump showed up, but we have heard scare stories from people about how sick you're going to get. Is there anything you can do? I don't know, Tylenol, ibuprofen, anything like that, that you can take after the shot to kind of ease those things?
Yes. The most common side effect from either of the three vaccines is just injection site pain and swelling. And
Okay.
again, I think we alluded to that earlier. This is your body's response, your immune response to the vaccine, because that's what it's supposed to do. It's supposed to help your body recognize parts of this virus and then pump up the specific cells that help identify parts of that virus, those spikes that you're seeing on the pictures that look kind of neat, but also a little creepy. And so that's your body's response. The same thing with the headaches. So most common is like headaches, injection site pain, some fatigue. It's usually mild, moderate, lasts 1 to 2 days. One thing about the Johnson & Johnson vaccine is that at least to date, there have been no anaphylactic reactions. So that's really good. But the number that have happened with the other two vaccines is so small, and the vast majority of those people that did have those anaphylactic or severe reactions, and there's criteria that you can actually go to CDC or the Ohio Department of Health on what they characterize as severe anaphylactic reaction. So, shortness of breath, high heart rate, dizziness. And so those are still even very, very rare per million doses of the other two vaccines as well.
Yeah.
So it is safe. So it is safe. That is the bottom line. And I don't think I finished that thought, that the majority of those people that had those anaphylactic reactions had multiple reactions to multiple medications in the past in prior anaphylactic reactions. And so they should have been DQ'd from getting the vaccine.
Okay. Who would do that? Would that be
things,
your doctor? Would your doctor suggest if you told him that you were going to go get the vaccine and he already knows your history, would he say, you know what, I think you might want to hold off. Let's check a couple things first, or let's do it in the office if we can, because I want somebody to be there in case anything does react. Dr. Fernandez?
So, yes, a doctor ultimately, should know the patient and advise a patient because a doctor knows the patient best. Most of the places where we are getting people are getting vaccinated, you have to wait 15 minutes. And certainly if you have any type of allergy history, the wait goes on for 30 minutes. It's well staffed. There's EpiPens, there's, things that we can do to help with the anaphylactic reaction if it does occur. For the majority of people, though, like Tony said, it's just the pain at the site. Fever, myalgias, and that can be easily taken care of with taking Tylenol or Motrin around the clock for the first 24 hours, and the symptoms do go away. So yes, you may feel terrible even after the second vaccine, but it'll go away. And that's part of your immune system saying, hey, you know what, this is something foreign, I'm going to fight it, and you'll be ready the next time around. The one thing I will add, not only as a personal observation of my patients, but also the data is there on the CDC website, is people who are older, that is above the age of 60, seem to have less of side effects than the younger people between their 30s and 50s. And there's no, in terms of racial preferences or anything like that, there's no difference. It seems like it's an age preference.
Yeah, and I know just from personal experience, like I say, I went to Mercy Hospital in Perrysburg last Friday. It took less than 10 minutes. In fact, I think I waited after my shot almost as long as the amount of time I spent checking in. I had all my paperwork filled out and actually getting the shot. So if you're going to do that, if you are going to get the shot, have your paperwork filled out. It's very simple. They just ask a few questions. Wait around. I think they made us wait for like 7 minutes. Nothing happened. We got up and walked away. I never did end up with a headache, but like you said, lots of water, probably no alcohol, and a couple of aspirin, and you'll be all right. Right, Dr. Armstrong?
Absolutely. There'll be no loss of limb. And
Well, yeah, that's the key. Let's talk a little bit about, because the questions come up all the time, and you've kind of touched on this, both of you. I'll start with you, Dr. Fernandez. What's in the vaccine? There's a lot of people who believe And I know there's no chip in it, but there are people who believe there's a chip in it. There are people who believe if you get it, it's going to affect the 5G for your cell phone service. There are people who believe that the vaccine actually contains the virus. How much of that is true and how much is false?
So that's, you know, first of all, there's no eggs, preservatives, or latex in any of the vaccines. That's the first thing. So people have to realize. Number two, if you want to actually know the specific ingredients, on the CDC website, you can go to each vaccine, and the pharmaceutical maker has a link to their website, and you can see the actual ingredients. There's nothing about the 5G network or anything like that. Those are conspiracy theories. There's no hidden chip. These are things that have been there. The mRNA vaccines, Moderna and Pfizer, the mRNA technology has been around for about 5 to 7 years, and it's just being, put in this vaccine. And the other one, in the Johnson & Johnson, uses an adenovirus vector, which is one of the oldest ways of getting the spike protein to get an antibody to it. So that's been tried and tested. So there's nothing conspiratorial about any of these vaccines. And like I said, it's been safe and it's proven, and you just have to look at the science. I think that's the bottom line in any of these vaccines. Look at the science, contact the pharmaceutical. There's no big conspiracy.
Dr. Armstrong, you want to add anything to that?
Well, the FDA requires, complete transparency as to what the ingredients are. And of course, in the manufacturing and the transport and the distribution process, it's very rigid. And so that's part of the safety. And the other thing is that, Dr. Fernandez, said going to the website, but it's pretty difficult for anybody, even, unless you're a chem major or a pharmacist, to really know what some of those ingredients are. But any concerns that you have, if you have a doctor, consult them, ask them what they feel about it, relate your concerns, and then kind of go from there. But, I kind of look at it like this. I mean, if you've ever had, chicken nuggets or you like hot dogs, who knows what the heck is in those?
I'm going to get letters about that. I'm just telling you right now.
I didn't name any specific brands, but I love both.
They're going to write to me about that. Someone has a question about surgery, specifically dental surgery. Is it better to have the vaccine before or after the surgery, or does it even matter? Either one of you.
Any procedure that you're going to have, you have to weigh the risks and the benefits. If you have dental abscess, that's a pretty serious thing, and you have to get them taken care of. If you have a heart attack, you have to get things taken care of. It is true for elective procedures, people get tested for COVID to make sure that they don't have it, so they're not exposing other people. But in general, it just sort of common sense. If you are able to get the vaccine before, but remember, it takes, just because you get the vaccine one day doesn't mean you're going to develop antibodies like the next day. So it takes a while to develop the antibodies. And most of the people, dentists in town that I know of, they've already gotten the vaccine because they're healthcare providers. Mm-hmm. So you would be spread, you're not unlikely to get it from them if that's a concern.
If you have questions about the ingredients, we've posted a link on the V Project. If you want to go there, you can go to vproject.org and get the information. And we've also put it in the comments on the Facebook page for the V Project. You can just click on that link and actually go right to the site that shows you what's in it. Now, as both doctors have said, you're not likely to understand a lot of it because a lot of it's chemical names. But I think we're pretty much cleared up the fact that it doesn't contain the virus. So it doesn't have chip in it. It's not going to make you infertile. You're still going to be able to have children afterwards, right, Dr. Armstrong? If I want to have more kids.
Well, you said you're 69. I mean, it might be a miracle drug.
Well, I'm not the one having it, though. We have a question from somebody who
it also doesn't contain eggs, preservatives, or latex. Just so
eggs, preservative, or latex. Yeah. Okay. Now, I don't know if either of you will be able to answer this question. We're going to start with Dr. Armstrong on this one. I had a friend whose stepfather passed away after 11 days after having his second dose, a healthy guy for being in his 80s. Can you explain, please? That's an
Well,
almost
no.
impossible question.
It is impossible because, first of all, obviously, none of us really know any particulars about this gentleman, and my condolences go out to his family. However, he may have had other comorbidities that had no relationship at all with his injection. Very, very, I can almost 100% say not related to actually getting the vaccine, because when we were talking about those severe anaphylactic reactions, those are going to occur on the latest, usually maybe an hour after the injection at the latest. So
Okay.
almost all of them are going to be 15, 30 minutes. So this is unrelated, but we don't know what it was.
What
All
can
right.
sometimes happen that we have seen is that patients are infected with the COVID virus before they get the vaccine. And then they can develop the symptoms after they get the vaccine, before they have time for antibodies. And so that's how they get sick. And remember, you get symptoms sometimes 7 to 10 days after actually being infected. So the patient may have been having those unknowns to him, and then got quite ill with the comorbid illnesses. Again, we need to know more information, but I echo from what I've seen, in the ICU and in my personal private practice, it is almost impossible that I would think that the vaccine caused this.
Okay.
Now, this is right up Dr. Fernandez's alley, but patients who are on oxygen too, some of them can actually desaturate, or their oxygen percent content can drop. And so those, if you're on oxygen, then you might want to be watched a little bit more carefully, a little bit longer, and maybe choose a site where you're going to get the vaccination, where they have resources to be able to help you out in case you do have an event.
Okay. So go to Mercy Hospital or one of the hospitals, as opposed to stepping into a Walmart or the Lucas County Rec Center. Go someplace where there's going to be medical personnel who can handle something stronger than just your headache and sore arm.
That would be my recommendation.
Okay. All right. I have a couple of email questions referencing the recent release of the Pfizer, stating that they are working on modifying the vaccine for efficacy against the UK and South African variants, which is likely affecting Moderna as well. How will this affect the millions of people who have already received the vaccine in terms of protection? Dr. Fernandez, we'll start with you.
So again, this is what we call the tweaking of science. These new strains have come up, and remember, the vaccine is attacking the spike proteins, not the actual virus itself, but the spike proteins that surround the virus. So as long as these variants have enough spike proteins, the vaccine is going to destroy it. And what we've seen is that the Moderna and Pfizer both seem to be still efficacious. I quoted the data that was just released, that in the real world, the Pfizer is still about 95% efficacious. So I think that takes into account the various strains that are coming up. But it's always good to isolate the strains, see if they have newer spike proteins, and make our vaccine even better. Now, could it be that we need a booster shot down the road? Yes, it's a possibility, and people have to realize that that's a real possibility, and not to say, oh well, we said one vaccine was good enough. No, we're not saying that. Just like we get a flu shot every year, we may need to get a vaccine. But that's right. At this point, conjecture. We need more information. We need more time to analyze the data.
Okay. And Dr. Armstrong, that was actually the second part of the email. Are we going to need 3 mRNA vaccines now to get the protection necessary? Are we going to have to get a booster every year? This is already a nightmare. Are we going to have to do this all over again?
Well, to step back a little bit, a mutation, these viruses, once they enter into the body, they replicate by the millions. And the genetic makeup of them, as they're replicating, they sometimes make internal mistakes, but they also have built-in internal mechanisms to not make as many mistakes. But a change in one of the genetic codes or more is what you get as a mutation. And then the way that it manifests itself are the variants. And the manifestations might be that it's more transmissible, that it's more lethal, but sometimes they can replicate to their own demise. So it's hard to know
Wow.
over time that they may not just burn themselves out. And they're more likely to do that when you get to that herd immunity. And so the thing about getting a booster, that's very likely, but we almost twice a year with almost every vaccine that there are updates on it. So I wouldn't be surprised, and I would count on that there's probably going to be either a change in the vaccine or a booster.
So if we do have to get another one next year, it's not going to be any different than having to go get a flu shot again, or an update on your lockjaw or anything else that you know have to get one. It's and the would it be a little bit stronger once the science tells you that we need to do this, we need to tweak it a little bit in order to fight off the UK or the other variants?
We just don't know at this point. The pneumococcal vaccine, there've been updates to it. And so we'll just have to see what happens. The point of the matter is, yes, it's an inconvenience. Yes, it's a nightmare for everybody, actually. People have been greatly damaged by this pandemic. But remember, over 500,000 people have died. And, you have to weigh the inconvenience versus living. And, I choose to live. And I think that's an important, thing that people have to realize. And many millions have been affected. Not, if they haven't died, they still have been affected by this pandemic. And our goal, scientifically so, is to have the virus burn itself out and get herd immunity.
All right. Well, now both of you have mentioned in the last couple of minutes the herd immunity, and I think people have an odd understanding sometimes of what it is. I've had callers call the radio show and tell me that if we just let everybody at the very beginning of this thing go out in public, not wear masks, hang around with each other, that we would have reached herd immunity. That is not my understanding of it. Dr. Armstrong, can you explain what herd immunity is when it comes to a virus?
Well, in its most simplistic form, for the virus to be able to survive, it has to have, a host where it can continue to replicate and replicate without any interference in that whole process. And through vaccination, sometimes whether it's passive, and so that would be from somebody who's infected that forms their own antibodies to it, versus active, where you are getting a vaccine, whether it's a killed virus or a non-virus vaccine. Then what you do is you are not allowing for that replication process to continue from person to person to person. And so when you have such a small percentage of people in a group who may not have that particular protection, that virus still will eventually burn itself out, because
Okay.
it needs bodies to be able to survive.
Right.
That's a pretty
And I have
simplistic.
heard some people, and both of you have mentioned masks. I have heard some people say they're going to continue to wear masks. For instance, Texas and Mississippi are saying they're going 100% back to business. That doesn't necessarily mean that you should remove your mask. How long would you think, and how do you feel, without getting political about it, should we continue to use masks? I'll start with you, Dr. Fernandez. Personally, for instance, how long are you going to continue to use one out in public, for instance?
When I'm working, I think I'm going to be using it. When I'm out in public crowds, I'm going to use it. And the reason I look at the data in Japan and some of the Eastern Asian countries,
Mhm.
and this is before COVID, and you look, they had a much lower amount of things like influenza and other viral transmitters, because culturally they wear masks. When anybody's sick there, the first thing that the people do is they wear a mask to protect others. They consider that part of their civic duty. And if you look at the rates of other infections that have happened this fall, the number of influenza cases dropped dramatically. And I think it's because people are wearing masks, they're doing social distancing, they're washing their hands. So, we have to live our lives. We have to go on. We can't stay on lockdown forever. That's not what we're saying here. But everybody should have a little bit of caution. There's no reason why you can't wash your hands. There's no reason why, if you want to wear a mask, you shouldn't be made fun of. That's something that people will choose to do. I think, especially in the immunocompromised patient, that might be a very good choice to make.
Mhm. Dr. Armstrong, I've got another email question. Are statistics being kept, and are they publicly available, as to whether or not a person who had the vaccine later tested positive, also which vaccine they had? I'd like to know if the vaccines are as effective as the testing trials indicated. I think this information would be helpful, including phases for 60 years and older. What do you know about that particular topic?
Well, for all the age categories, across all demographics, these are ongoing clinical trials. Okay. So we talked a little bit earlier about severe reactions. Those are reported. There is also websites that you can go to through the CDC or the Ohio Department of Health of VAERS or adverse reporting for vaccinations. And what they will do is they will track you for as long as they need to. And it may be up to a year after you've received a vaccination. So that there are mechanisms where you can just go online and report what is going on to you. And they may, depending on what you report, actually give you a phone call back from the CDC for more information. So they need to be able to track events over time to be able to know what the long-term effects are, right? Because we don't know, because we've just started vaccinating.
So the science, Dr. Fernandez, the science is continuing to evolve as we go through this thing. It's always going to be changing, right?
Right. We don't know, for example, how long the antibodies from these vaccines will last. We assume it's going to be at least 6 months, and we don't know if we're going to need, like Tony said and I said, we may need some shots down the road. The point is that we want to get rid of the burden of the vaccine. You alluded to about, well, what if people just didn't wear masks and, we all could have gotten it? Yeah. That's assuming a very 100% healthy population. That's not the United States. We have high rates of obesity, high blood pressure, diabetes. If you're exposing people, your own citizens, you don't know what they have. You don't know their personal history. I might look normal to you on the outside, but I might be HIV positive. I might have tuberculosis. You just don't know. So part of it is a civic duty. And I think that's why you see that in Japan and things like that. Other countries are different than the United States.
All right. One of the people watching online, and we're online, by the way, on the V Project Facebook page, also on the Lucas County Health Department Facebook page. This is also being recorded, and it'll be available later. If you came in late, or if you'd like to share it with your friends, you'll be able to access it through a link. If someone has already been affected, Dr. Armstrong, please explain, why did they still need the vaccine? I've already been through it. I've had it. I went to the hospital. I got better. I'm out. Why would I bother even getting the vaccine then?
Well, I think Dr. Fernandez, kind of touched on that with his last comment. And we don't know how long the antibodies actually last, even if it's just from infection that you have gotten. How long do you have that protection? Is it going to be for 90 days or is it going to be longer than that? And so we also know, but we don't have enough data points to really understand about reinfection, even reinfection with the same strain, or now, more importantly, with these new variants that are coming up. And so as science evolves, I think the absolutely most prudent thing is that you get your vaccination, because it can help protect you down the road from new variants, even outside of the 3 that we are looking at now, with the UK one being probably the most virulent and transmissible one.
Okay. I want to stay with you for just a second because you're an OBGYN. Is there any information that you can pass along to women who are currently pregnant and who know that they are about the vaccine? Are there any worries for women who are with child right now?
Yes. Yeah. Well, a little bit of that history is there's an advisory committee on immunizations in the United States, and ACOG, which is our body that board certifies OBGYN. So the American College of OBGYN, they have representation on that committee. And they made a recommendation on pregnancy itself, which actually is in the phase 1C that's up right now. So they categorize it as a high risk condition. And so being pregnant, first of all, because of the way the vaccine works, it does not get into your cells, to the nucleus of your cells, so it cannot interact with your DNA. Therefore, we think just based on the way it works, that it can't cause birth defects. But in the original trial, there weren't any pregnant patients in it. Several got pregnant. They had been followed. I don't know if they delivered because they were still pregnant in the middle of February, and the pregnancies were going uneventfully. So we don't have the actual safety based on experience, but based on mechanism of action. It should not be withheld for a pregnant patient versus a non-pregnant patient. And on top of being pregnant, you are more likely to be hospitalized, put on a ventilator, and a slightly higher risk of mortality if you're pregnant compared to your non-pregnant counterpart. And then if you add in other things like race, ethnicity, and other comorbidities, those just add to it. So you should not withhold it for being pregnant, shouldn't require a pregnancy test. Talk to your obstetrician if you have questions. And the same thing with breastfeeding, or even thinking about becoming pregnant.
Yeah, it sounds like the key for a lot of these questions that people have, especially the conspiracy theories and other things, is that to consult with your physician, to sit down and ask him these questions. He has access to the websites, you do too, but he probably has a better understanding of what the CDC is trying to explain to you than you might have. Dr. Fernandez, you've been dealing with this for a year now. What problems have you come up against, if any, in trying to convince people to get the vaccine?
The greatest fear is, is that they're afraid that they're somehow going to get COVID, which is not true. You don't get COVID from the vaccine. The second fear is the reactions. Am I going to have an allergic reaction? And as Dr. Armstrong said, the incidence is lower than the regular vaccines that we already have. And so that's not a reason. What's in the vaccine? Again, there's websites of pharmaceutical, but they don't contain the main ingredients. The sicker the patients are, which I see a lot of patients with emphysema, asthma, sleep apnea, those patients are the ones that need to get the vaccine. And we actually, we have printed out handouts from the V project, and we hand them to the patients. I try to convince them. I can usually get an idea very quickly because they're my patients if they're going to agree to me or agree with that sentiment, or they're just going to not. You see their eyes sort of glassy. And I just give them the handout, and I think it helps them because the website is excellent, and I would strongly recommend people who have questions to go to that website. The CDC is another great website. These are, the V Project, these are our people gathered from the Northwest Ohio, business leaders, politicians, physicians, churches, mosques, temples, and they've all gathered together. And, we're not going to do anything to harm our community. We want our community to get better. We want the Toledo community, Northwest Ohio community to be stronger and get rid of this. We're sick of it.
Well, I don't know how much time either of you spend on social media. I probably spend a little bit more time on Facebook than either of you, I would imagine, just for
my wife
job.
says I spend too much time. And my kids say that too.
So I see a lot of the weird stories. I see a lot of the weird conspiracy theories and things like that, and are fighting them every day, which is exactly why we joined the V Project, to try and help get the word out there, to kind of, we call it Freducation, to let people know that it is safe to get. In fact, the sooner we get more people vaccinated, right now we're at 16.7%, and I think Wood County is a little over 17% ahead of us right now. What kind of number, Dr. Armstrong, do we need to get to that you would feel comfortable with? I mean, besides 100%, obviously, but where would you start to breathe a little bit easier?
Well, if we can get above 70%, certainly. So I think 80 would probably be the high water mark. But, getting specific populations of people to get vaccinated are separate mountains to be able to climb as well. So
Yeah.
specifically, in the African American and, Hispanic, Latinx populations, talking to them, trying to understand their concerns, because a lot of it may be historical.
Mhm.
And so to be able to sit them down and say, if you're hesitant, why are you hesitant? And to be able to tell them about how these trials were done, the breakdown and the makeup by race, even some of the lead people who were involved in developing the vaccine, one of them being an African-American female from North Carolina, Dr. Corbett. And so you kind of sit them down and then talk about the misinformation that you just mentioned, the things that you see on social media, and sort of just kind of one off of them. And then it's a shared decision-making if you're talking to your physician, but you might be talking to your boss or a coworker. And so it's giving them the resources to say, like Dr. Fernandez said, you go to the CDC website or you go to the V Project and you will get consistent messaging about the vaccine. And then they can make an informed decision on themselves. And I think that's the best thing that we can do.
Yeah,
And then the
absolutely.
people that have already gotten the vaccine, they can be witnesses to the fact that, hey, look, I got the vaccine and nothing happened to me, or only minor things happen. Now they need to spread the word out in their communities. And I have many patients that I saw this past week and the week before that have gotten both vaccines, and they are going to talk to their neighbors and their friends and their relatives and say, hey, I'm a witness to this. Again, we want to get this Northwest Ohio and the country back to where it should be. And I think this is the way to do it.
Yeah, I think that's key, is to let people know that you've done it. I have a lot of friends on Facebook who, in fact, one of them just got the vaccine today. I've been promoting the fact on my show that I got mine on Friday and I had no side effects. And so we're letting people get that word out as much as possible. The V Project's doing a great job with that. If you need information, go to vproject.org. They're also on Facebook. And of course, the Lucas County website, and a bunch of new appointments have just opened up, and the governor has kicked it back to 60 and older. So if you go to either of those two websites, V Project or to the Lucas County Health Department website, you can get information on scheduling an appointment real soon, and we can up that 16% to 20, 30, 40, and a little bit higher. One more question, Dr. Fernandez, let's try you first. If you are getting another vaccine for something else, someone specifically mentioned shingles, for instance, should they wait? Is there a problem with getting a shingles vaccine or a flu vaccine and then the COVID-19 vaccine? Do they mix? Do they mingle?
They don't mix and mingle.
Okay.
Again, it's one of these things that we don't know how long specifically you should wait. But you have to, again, the risk versus the benefits. Okay. If you're in an area where there's a high amount of people or a population that has COVID vaccine, you choose to get that one first. But we're just waiting. Again, it's a science. We have to wait and see what some of the data, but there's no mixing and mingling. If you get one, your immune system isn't going to be down that you can't get another one down the road. So.
All right. I want to give each of you an opportunity, kind of like closing statements at a debate, to say whatever you'd like to your patients, to the general public about the vaccine. Dr. Armstrong, we'll start with you.
Well, the first thing that I would say is that, we are trying to, through trusted voices, whether that's your physician, whoever you consider a medical expert, if you're faith-based, whoever it is, it's that trusted voice to try to find consistent messaging about the safety and the efficacy of the vaccine and why it should be important to you, and to be able to direct you to resources that are available, that if English is your second language, that are tailored towards minors. We are coming up with all kinds of different ways to reach out to every population of person that's out there. And so if not for yourself, it's for your family, it's for your friends, it's for your coworkers.
Thank you very much. Dr. Fernandez, you've been working in the ICU for the last year with people who are suffering from this pretty dangerously and sometimes greatly. What's your message to people about getting the vaccine? Why is this so important?
It's first of all, before I give my end statement, I want to just say thank you. Thank you to the physicians, nurses, respiratory therapists that I've worked with over the last year. It's been a hard year, very hard year. I'm not going to lie. I want to thank my family as well for sticking by me. The nurses and respiratory therapists at Bay Park Hospital, St. Charles Hospital, St. Luke's Hospital, they've just been wonderful. We want to get this area back on track. It is part, as I think, of our civic duty to look and see what are the best ways to do that. And we've done social distancing, we've done the masking, the vaccine is an opportunity, and we have to get that word out to our people who are not able to necessarily go to the hospitals, who don't have transportation. We have to get these communities involved, and we need the leaders of these communities, whether it's a pastor, a priest, a politician, Joe in the bar, the bartender, whatever, it doesn't matter. We need to get the word out, and we need to have ways to get people vaccinated. It's no good to have vaccines and no one to give them to, or no one to administer them to. So we need to do that. And I think once Northwest Ohio does that, people will see. The V Project, there's no other area in the state or that I'm aware of that is focused like we are. And I want to thank Sean Savage for his leadership in this. So I take this very personally about trying to get this area. I grew up here, I came back to town, and I want to see Toledo get back on its feet again.
Thank you very much, Dr. Fernandez. Dr. Armstrong, thanks for your time tonight. If you need more information, and almost all of us do, you can go to the CDC website, and go to vproject.org. You can go to the Toledo Lucas County Health site, the Health Department website. All of those are also on Facebook, and the information is available. If you have a question, I think one of the things we heard tonight, more often than not, was to please talk to your personal physician. And if you don't have a relationship with one, and I know that there are people out there in some of the communities who don't, please reach out to the health department. They do have the answers. They will take the time to answer your questions and alleviate any fears that you have. The sooner we get to 60, 70% immunization, the sooner we get to that herd immunity that we all like, and we can get back to work. Gentlemen, thank you very much for your time tonight. City of Toledo, Health Department, and V Project, thank you very much. Have a good evening, and we'll do this again real soon.
Thank you.